I am a minimally invasive surgeon in the Department of Surgery in the section of general surgery. My clinical practice is mainly at the Veterans Affairs Hospital. From the academic side and research side, I am a member of the Center for Healthcare Outcomes and Policy here at the IHPI. I also have a joint appointment in the School of Business. So I always had an interest in medicine, when I finally started my general surgery residency with the goal of becoming a congenital heart surgeon, really my first few years of residency I got to witness multiple instances where patients did remarkably well after surgery. Unfortunately, many instances where patients had what would be kind of deem a small complication, but unfortunately that kind of led to a cascade of events, dominoes if you will, that would continue to fall and some of those patients would die. After my third year of residency, I had the opportunity to take 2 years out to do a fellowship, a research fellowship. And during that time, I really kind of honed in on that question of how can I make care safer in that post-operative period. And I came across an idea called failure to rescue. And that's essentially what my whole life has become and is about now. The paradigm in the past was, let's try to prevent major complications from occurring in the first place, which is obviously an important thing and I don't want to minimize that. But I think that a lot of what we've done in healthcare over the years has led to making care fairly safe and minimizing complications to a great extent. But I think we've kind of missed the boat and haven't focused on that post-operative period as much as if there is a complication, how do we respond to it? So we decided to take a look at other high-risk industries such as nuclear power plants or aircraft carriers, anywhere where a small adverse occurrence could really lead to catastrophic consequences. And what they've done is essentially focused on every little bit and piece of the pathway from where they start to where they end. And so failure to rescue is just kind of a way of evaluating that post-operative period and understanding what happens when a patient has a complication and what can we do to prevent those dominoes from continuing to fall. The impact of my work, I think, can be very concrete and distinct. It's obviously to improve safety after surgery. I think, though, that I would like the impact of my work to be a little more broad than that, and I think it would be to improve organizational systems and design within hospitals. I think a key component of that is improving the culture and the safety culture within these institutions. From there, the benefits are fairly obvious. There'll be many downstream benefits to patients, providers, and society as a whole. I think the major issue facing healthcare today is improving efficiency while not diminishing value. It's important to reduce how much we're spending on healthcare, but without adversely affecting quality. And I think a lot of that requires a change in focus on what we're looking at within healthcare. Is it overuse? Is it efficiency in care? Is it improving outcomes in care? Or all of those linked together? And so in my mind, I think patient safety in the perioperative period for me, as a health services researcher who's a surgeon, appears to be the most important area to focus on. The IHPI is a unique institute that brings together people from various backgrounds, anybody with a stake in improving healthcare, together in one building to collaborate on improving care and quality together. I think it's unique in the sense that many institutions have all the puzzle pieces that we have here at the IHPI, but haven't been able to really piece those together. Now I can step out of my office, walk down the hall, and I suddenly bump into a health economist that I never would have met before. I think it facilitates that kind of organic collaboration and interaction. The way I envision the future of healthcare and IHPI's contribution to that future is really developing and improving on the integration of healthcare. I think that developing more highly integrated healthcare delivery systems is important, and I think that IHPI has taken the first steps in promoting and operationalizing that vision and that dream.